Greetings.
Hello.
I'm here with Dr. Misani Kambi Shamba. Dr. Demisani, I have a question for you.
Okay.
What does Chinese medicine offer to fibroid patients?
Okay. Chinese medicine is quite broad, and there are a lot of different modalities. Most people hear about acupuncture. That's what most people know. There's herbs. In addition to herbs, there's qigong, and then there's body manipulation. It's sort of like massage. They call it Tui Na. And those are the four major aspects of Chinese medicine. There are other things go into acupuncture. There's, Chinese medicine is. The qigong is really one of the biggest methods in self work in Chinese medicine than anything else. You take qigong home with you. You can do it every day, twice a day, 3 times a day. And it has the same effect on the organs and channels and meridians and as the acupuncture and herbs do. Now, let's just talk a little bit about fibroids in relationship to Chinese medicine. Fibroids in Chinese medicine has 4 what they call diagnostic patterns. The first pattern is called liver qi stagnation. Now, that sounds like, what does that mean? Well, basically, liver qi stagnation is mainly an emotional-based disease. It does have some physical symptoms. The physical symptoms would simply be things like flank pain, maybe stomach pain, and but mild pain, and maybe slight headaches. The mental and emotional symptoms are much higher. You have anger, depression, frustration, shouting, all of those different things. So that's how we would diagnose liver qi stagnation. And liver qi stagnation is at the cornerstone or the foundation of all diseases in Chinese medicine. Because the liver organ likes to, express itself, and when it can't express itself, it gets blocked. So really in Chinese medicine, I found a real, doorway into why many people have fibroids. Now, fibroids is a further extension of that pattern, and I'll talk about it in a minute. But that at the core is this liver qi stagnation. And usually you'll find this in people, and aside from, the world, when they do studies, they'll see fibroids across the world. They'll notice that the fibroids it has, especially in the biggest cases are in African American women in the United States. They do find it in England, they do find it in other countries. It's rare in Africa, it's not as pronounced in Africa. You don't see, or at least the reports from Africa and Brazil and places like that, you don't get much. I do find it in the Caribbean to some extent, but many of the Caribbean American women, not Caribbean women in the Caribbean. So I see it's a phenomenon here more so than anywhere else. And at the basis of it is this idea of liver qi stagnation, which has this big emotional component to it. So that's why we start off by talking about, managing your emotions, managing stress, and things of that nature. That's at the cornerstone of the therapy. And that's why when I do the therapy, I add all these other things in that may seem unrelated. Secondly, besides that, you have let me go back to liver qi stagnation. That's usually in women, we call that PMS. Those PMS symptoms that you have. The tiredness, the slight pain. This is the week before you have your cycle. Headaches, the mood swings, all of those different things that go on just before you have your cycle. The week before you have your cycle, that is liver qi stagnation. So that is a very, pronounced way to understand that you are on your way to having fibroids if you don't check that. Okay. After liver qi stagnation, there's another progression of it. It's called liver blood stagnation. Now, liver blood stagnation is now severe cramps and pains during your menstrual cycle. That is now pretty severe. And one of the features of that is that you have clots. The blood is dark. There's a lot of stabbing pain in your lower abdomen, sometimes your back, sometimes your thighs. And it also has the emotional component of liver qi stagnation. It's a compound to that. And sometimes that can even be even worse in terms of the emotions. A lot of arguments, anger, really kind of on the far end of it, And part of that too is the idea of holding things in, not expressing things out, right? you express them inappropriately, like you get angry at the wrong time. I mean, there's a proper time to express yourself, and so that you can get your ideas out. And if you have a relationship or something that you're doing where you don't have that forum or that avenue, there's something's wrong with that relationship. So you have to figure that out. You have to talk to, your boss or your significant other, to really work that out so you can have an opening. However, part of the problem is that you're socialized as a woman to, submit, or the idea of submission with women is that, the gender bias and, sex bias, and of course the race bias is there as well. So you have those things that are layered on top of it. And so you're trying to, as a person, trying to be a whole person or trying to be yourself, and the society got all these things layered on top of you, and you're responding with this frustration because you can't be who you are. Like, the way you look in the Western world is like, you can't be your natural self because there's something wrong with that. And so women are, deeply, and profoundly affected by that. Why can a woman who has less melanin than you and her hair is brown or straight be accepted in her natural state, and you can't? Okay, that goes deep into your psyche, who you are as a person. So you have these different things just layered on you. So this liver chi stagnation, it might sound like, superficial, but it is quite deep when you go into it. So the work on trying to remove that is that it's a discovery process of you understanding what it is that, the triggers that make you feel a certain way. And those triggers may not be anything to do with your relationship with your boss. It might be, based on some society or cultural things, or things that you grew up with in your household or your community. So you have to ferret this out. And this is why I say this is medicine. Since it's affecting such large amounts of women, then, and black women and specifically, then there must be, when they talk about epidemiology, which is the study of medicine of large groups and what things affect people, then you have to look at that in terms of black women as a group. And so you just can't factor in just health as a physical manifestation. In Chinese medicine, we do the mind.